Now, Dr. Majid, you can present your slide, please.
Yes.
I will stop my share.
Yes, thank you. Okay, Dr. Saad, can you see my presentation now?
Okay, full screen, please.
Yes.
Thank you. Okay.
Thank you, Dr. Saad, for this nice introduction. First of all, I would like to thank all of my friends and colleagues who asked about me and prayed for me and wished me an eventful recovery from my illness. And because of their prayer, I passed this illness, alhamdulillah.
Alhamdulillah, as-salama.
Allah yasallik. Second, I would like to thank the Iraqi Association for Medical Research and Studies for providing us this platform and hosting this meeting to discuss important issues about research. Today, I will talk about the first step of medical research, that is how to design the study. You know, we need to be very concise, very well prepared before we start the process of research. We have to know what type of study design that is best fitting or suiting our research. In order to know the best design that fits our research, we need to know what is called the clinical question. You know, we conduct a study or research in medicine because we have a clinical question that we need to answer. And depending on that type of a clinical question, there are many types, we're going to see that later on. Depending on the type of medical question, we will design our study. So medical question or clinical question is the very important first step in the study. And in order to make our work organized, we have to formulate that medical question. This is done through what is called the Pico. And this is what I'm going to talk about. So formulating the clinical question is summarized in Pico. And Pico, it consists of 4 letters, P, I, C, and O. Each letter of these represents a word. So it is a mnemonic that helps us to remember what we have to remember when we formulate our clinical question. So let's see, what are these? Start with the letter P. And P reflects or represents several things. First of all, it might reflect the population. So you should ask yourself, who are the people that I am going to conduct my study on? Who are the subjects of my study? For example, you want to know what is the prevalence of type 2 diabetes in a certain area of the community. So the P here is the population who are living in that area. You will include all those people in your study. So the population means the inclusion criteria, whom you are going to include in your study. Sometimes the P means patients. So, for example, you want to test a new medication as a treatment for hypertension, and you want to do a study about that. So here, clearly, the patients, the P of your Pico will be patients with hypertension, okay? And sometimes the P is not population or patient, is a problem. So you are facing a problem in the community, and you want to look for a solution for that problem. Here might be the P. The problem is the P. Okay. So you should ask yourself, who are the patients that I'm going to conduct my study on, or what is the problem that I would like to solve by doing my study. Good. Now let's go to the next letter, that is I. And I again may mean intervention. And actually I is the very important of all the four letters because it will decide which type of a clinical question you are asking, and therefore it will give you the best design for your study. The I is the intervention. For instance, we want to try a new medication for hyperlipidemia, for high blood lipids. So here we give this medication to treat that condition. We do a test or a study. Sometimes we want to try a new surgical procedure, and this is the intervention. Okay? Sometimes the I might be a new modality of investigation. You want to test a new test or blood test or whatever type of investigation to diagnose a condition. This is considered also I. Or it might be exposure to certain things. Now we are living in the era of COVID-19, and you may want to test the exposure to this virus, or you want to test the exposure not for a biological agent, for a physical or chemical agent, for radiation. You want to see how many people living in certain area are exposed to the radiation, okay? And what are the consequences of exposure to that radiation? So this is the I. So in the I of the Pico, you should ask yourself, what do we do to those people or patients that we choose for our study? Or what are they exposed to? So you may include only people who are infected with COVID-19 in your study, for example. The third letter of the Pico is the C, and the C stands for comparison. Always we want to compare the intervention with a comparator, okay? So here the comparison usually with the placebo. In case you are using a medication, you have to compare your medication with a placebo. And the placebo here could be nothing, or could be the standard of care. That is the best available treatment for that condition. Or the comparison is between one blood test that you want to use for diagnosis of certain disease with the gold standard, the blood test of that disease, and etc. So you should ask yourself, what do we compare the intervention with? Always, you should compare your intervention to another thing. Okay, for example, if we would like to study the effect of convalescent plasma infusion for patients with COVID-19, we should give people with COVID-19 plasma, and we should give other people without COVID-19 other treatment other than plasma, and we compare the two things together. This is the correct way of conducting the study. And finally, the last letter is the O. And the O, as you know, it stands for the outcome. What is the target of your study? What is the solution that you are looking for in your study? What is the answer that you are expecting to your clinical question? This is the O, the outcome. So we should ask ourselves, if we give these people this medication, compare it with other one, what is going on? What will happen? Or what is the outcome of our study? What is the expected outcome? What we should look for in our study? And the outcome is divided usually into primary outcome and secondary outcome. And the primary outcome is the main outcome of your study, the main result that you are looking for. The secondary outcomes may be one or more. It may be the other things that you may look at during conducting the study. And we'll talk about this later on. So to recap so far, remember the Pico, as you can see here in this table. The P might mean the population or patients or problem. And you should ask yourself, who are the patients in my study? What is the problem that I should look for a solution for it? The I is the intervention or exposure. And you ask this question, what do we do to these people in our study? Or what are they exposed to? The C is the comparison. And you should ask, what do we compare the intervention with? And finally, the O is the outcome. What happens to the patients or population? And what is the outcome of our study? So in order to make this practical, let's take a real example. This is an article, well-known in medicine, that was published in the New England Journal of Medicine several years ago, or a few years ago. It was about dapagliflozin and cardiovascular outcomes in type 2 diabetes. Dapagliflozin at that time was a new medication. It hasn't been uh, given to people. It was a novel medication. It acts on the SGLT2 receptors in the kidney, so it takes sugar from the blood into the urine. So they wanted to test the effect of dapagliflozin on the cardiovascular outcome in patients with type 2 diabetes, because the FDA does not approve any new medication, even if it is effective, unless it passes the cardiovascular outcome safety profile, unless they make sure that this drug is safe. Okay, so let's apply this in the Pico. The P here is clearly patients with type 2 diabetes. Remember? So in type 2 diabetes, so the patients of the study are people with type 2 diabetes. The intervention, the I, is the drug itself, dapagliflozin. Okay? And the comparison, the comparator, is the placebo. And here, in fact, the placebo is not nothing. It was the standard of care. It was the best available medication for type 2 diabetes other than dapagliflozin. And the outcome of this study, if you remember, cardiovascular outcomes. So the outcome, they had two outcomes. Primary outcome, the major outcome was the major adverse cardiovascular events, what we call it MACE, which include myocardial infarction, ischemic heart disease, and stroke. So they gave patients dapagliflozin with type 2 diabetes and compare it with other people with type 2 diabetes who were given placebo. And they followed up the patients for 5 years. And the primary outcome of their study, they measured how many people got major adverse cardiovascular event, how many people got myocardial infarction or stroke or ischemic heart disease. And they included a secondary outcome, and that was the renal failure. Also, they measured how many people developed renal failure in the two arms or groups. I hope this example is very clear. Let's take another example. So you know now in COVID-19, the gold standard test for the diagnosis is the real-time PCR, okay, through the swab. And you remember there was a talk about the rapid test, which is a serological test that detects the IgM and IgG against COVID-19 in our blood. So the scientists tried to test the efficacy of this new diagnostic tool in detection of COVID-19. And they published this paper in the form of letter to the editor a few months ago. So it was about the performance of the new test. They wanted to try a new blood test for the diagnosis of COVID-19. Let's apply this in the Pico. What did they do? The P, patients, is very clear. Patients with COVID-19, okay? The intervention here is not a medication, actually. It is a new blood test. It is the COVID-19 IgM, IgG rapid test, okay? The comparison here should be the gold standard test for the diagnosis. So we compare the new test against the well-known established all test. That is the real-time PCR or the swab. And the outcome, of course, when you are looking for the validity or the efficacy of a new test in detection of a disease, you should look at the sensitivity of the test, the positive predictive value, and negative predictive value of that test. So in general, Pico is very important because it will clarify your question. It will make it very clear for you and for others. It will determine the search concept. Even when you want to search the literature looking for what is written about this subject, it will help you because these words, the PICO, are the words that you can use as a keywords in your search. And also it will determine the type of a study that is most appropriate to answer the question. And this is the very important thing that I talked about. Why is that? Because type of a clinical question will give you a hint about the best type of a clinical study that will suit your research. So the question we got, the clinical question, we have to classify it. The clinical question that we formulated it in the form of Pico, it could be a therapy question. Just like the dapagliflozin question, it was a therapy question. So the best type of a study design for a therapy question is a randomized controlled trial, followed by a cohort study, then a case control study, and lastly by a case series. If it was a question in the form of a diagnosis question, such as that with the COVID-19, so the best thing to do is a prospective study, followed by a blind comparison to a gold standard or a cross-sectional study. If it was etiology question, just like therapy question, the best type of study is randomized controlled trial, followed by cohort and so on. If it is a prognosis question, for example, we want to follow people who have thyroid cancer for 5 years and see how many people of them will die, then the best type of study is a cohort study, followed by case control and then by case series. If it is a prevention study, it's just like therapy or etiology. For example, you want to test the efficacy of aspirin in preventing cardiovascular event in people with type 2 diabetes. This is a prevention study. You want to prevent an outcome by giving a drug. The best modality of doing the study is through randomized control trial, followed by cohort study, and so on. If it was a clinical examination question, then you do a prospective study or blind comparison to a gold standard of care. And finally, if it is a cost question, then you do economic analysis, and we rarely use these types of studies. So let's return back to the same two examples and apply them and apply the concept of according to the type of a clinical question, we're going to choose the type of study that best suits our research. Okay. So in this example, the dapagliflozin and the cardiovascular outcomes in type 2 diabetes, this is very clearly a therapy question. We give a therapy, a medication to test. So the best type of study here would be a randomized controlled trial, and this what they did actually, the researcher in this study. While the second example, and that was about the COVID-19, the rapid test, this is very clearly, this is a diagnosis, a type of a clinical question, and therefore the best type of study would be a blind comparison to a gold standard, and this is what has been done. They blindly compared COVID-19 IgM, IgG to the gold standard test, that is the real-time PCR. However, there are limitations of designing a clinical study. It's not a very simple thing, because selection of the appropriate study design is limited by, first of all, the type of research question, by the disease of interest. Sometimes the disease is very rare and you cannot collect adequate sample size, the time some people they got to submit their paper within a specified period of time because they have assignment. The available resources, you know that research, especially in Iraq, you have to fund yourself. Nobody will fund you. And finally, of course, the problem with the ethical considerations, because we are not so familiar with the ethical committees that can provide the ethical approval of the studies. By this, I am going to finish, but I would like you, after the end of our presentation this evening, each one of you to try some clinical question in his mind and to try to formulate that question in the form of Pico. And thank you so much.